In this section, we will discuss the use of a fenestrated pencil point needle for nerve block at the level of the popliteal fossa. As we have mentioned earlier, there are a number of techniques that can be used to perform most nerve blocks. This needle is one more tool that can be used as needed. Contact information for this device is seen at the bottom left of the screen. We will discuss the use of this needle for injection medial to the sciatic nerve at the level of the popliteal fossa, as well as for injection between the tibial and peroneal nerves at the level of the popliteal fossa. A variety of fenestrated needles are available. The needle shown here will be used to perform sciatic nerve block. It has a pencil point that provides visual and tactile feedback as it is advanced through tissue using ultrasound guidance. The distal 2 centimeters of the needle has side ports along alternating sides of the needle. The inflow pattern during injection is demonstrated in this video. A common approach to the sciatic nerve block in the popliteal fossa is to advance the injecting needle to a position in contact with or in immediate proximity to the nerve. This technique may cause painful paresthesias or even trauma to the nerve. An alternative to this method is to position the injecting needle medial to the nerve and inject local anesthetic into the fascial compartment containing the nerve. Within the popliteal fossa, and particularly between the sciatic nerve and the semimembranosus semitendinosus muscle, there are layers of connective tissue oriented primarily in a coronal plane. These tissue planes can affect the distribution of local anesthetic. In this image of the popliteal space, we see an extensive distribution of this connective tissue. Although not all images display such a graphic example of these tissue planes, they can be observed by careful ultrasound examination in nearly every patient. In this MRI of the left leg at the level of the popliteal fossa, we can identify the femur, the semimembranosus semitendinosus muscles, the biceps femoris muscle, as well as the popliteal artery and popliteal vein. This image displays the tibial and peroneal nerves immediately inferior to the division of the sciatic nerve. Careful examination also shows the connective tissue extending between the superficial surfaces of the tibial and peroneal nerves to the semimembranosus semitendinosus muscles. A large white arrow shows the path of an injecting needle during an injection medial to the sciatic nerve. In this slide, the image on the right orients the viewer with respect to the position of the ultrasound transducer on the leg. On the left, an ultrasound image shows the investing fascia of the leg. Additional layers of connective tissue are also seen extending between the sciatic nerve and the semimembranosus semitendinosus muscles. Note that during hydrodissection, injection distribution is altered by these tissue planes. This slide demonstrates the injection of local anesthetic medial to the sciatic nerve using a 20-gauge fenestrated needle displayed on the left. The distal 2 centimeters of this needle has side ports on alternating sides of the needle shaft. The outflow pattern during injection is displayed. The ultrasound image displays the semimembranosus semitendinosus muscles, the biceps femoris muscles, the popliteal vein, and popliteal artery. The sciatic nerve is also displayed, as well as a white arrow indicating the path of the injecting needle. As injectate flows from the distal 2 centimeter fenestrations, there is extensive spread of local anesthetic around the nerve. Nerve blocks in the popliteal fossa below the division of the sciatic nerve are also popular. When blocking at the level of the tibial and peroneal nerves, onset is reportedly more rapid due to the smaller caliber of these individual branches in comparison to the larger caliber of the sciatic nerve. In addition, the imaging depth required to visualize the tibial and peroneal nerves is usually more shallow than that required for the sciatic nerve. As always, a direct approach to these nerves can be associated with painful paresthesia or injury. An alternative is to advance the needle between the tibial and peroneal nerves, thereby avoiding contact with either of these structures. This is an example of the distribution pattern using a fenestrated needle between these nerves. In our last example, we will show the distribution of local anesthetic produced by injection through a fenestrated needle with 8 side ports on alternating levels along the distal 2 centimeters of the needle. The outflow pattern from the needle is displayed on the left of the screen. You will also note connective tissue oriented in a coronal plane both between the nerves and superficial to the nerves. At the end of injection, there is extensive spread of local anesthetic around both the tibial and peroneal nerves. The fenestrated needle is one more tool that can be used to perform nerve blocks without immediate proximity to the nerve. Thank you.